Topic: Diagnosis and treatment of urinary tract infections in children. Let's break this down for the exam. Okay, so acute urinary tract infections, they're pretty common in kids. And you've really got to stay on top of this because the guidelines for diagnosis, treatment, and follow-up are always evolving. Getting this right is absolutely crucial for preventing some serious problems later on. First, let's get the prevalence and the main pathogens straight. By age 7, something like 8% of girls and 2% of boys will have had at least one UTI. And the bug causing it? It's overwhelmingly Escherichia coli. We're talking about 85% of all cases. Second, who needs to be evaluated? Well, any febrile child between 2 and 24 months old with no obvious cause for the infection should be checked for a UTI. The one exception is circumcised boys who are older than 12 months. Now, the reference standard for diagnosis, and this is key, depends on the specimen. For a catheter sample, you're looking for greater than 10,000 colony-forming units. For a clean catch, it's a lot higher, 100,000 or more. And finally, treatment and prevention. Because of increased E. coli resistance, amoxicillin isn't the best choice anymore. The recommended initial antibiotic for most kids is trimethoprim sulfamethoxazole. And here's a big point on prevention. Prophylactic antibiotics don't actually reduce the risk of future UTIs, even in children with vesicoureteral reflux. A much better strategy is just to make sure the child avoids constipation. Remember, underlying problems like renal scarring and renal disease can lead to considerable morbidity later in life. End of session. Check your revision map now.